we can get started. So hi, everyone. Welcome to the February session of the Research Seminar Series. Thank you for joining us today. My name is Maria, and I am a program assistant with the BC Brain Wellness Program, and I am very excited to be hosting today's session. Today, we have two very special guests, Cheyanne and Amanda, who are part of our very own BC Brain Wellness Program team. Today, we will be exploring how lifestyle practices such as nutrition, exercise, and mindfulness can support brain wellness, and learn about a new and exciting research project focusing on looking at brain health from a 360-degree approach. I did also want to bring light to our next session of the Research Seminar Series happening next month. The topic is on non-invasive neurostimulation therapies. I will just be popping the link for the registration page in the chat in case this is something that you would like to sign up for and listen to our next talk. Before we dive into today's session, I would like to first acknowledge that the BC Brain Wellness Program at the Tujabid Moafagian Center for Brain Health is situated on the traditional, ancestral, and unceded territory of the Hunkaminam-speaking Musqueam peoples. I would like to invite you all to take a moment to acknowledge and give thanks to the land that you are joining us from today. There are additionally also a few housekeeping items to keep in mind. If you have any questions throughout the session or any thoughts that you would like to share, please feel free to send them in the chat box, and we will get around to them later during our Q&A session at the end after the presentation. Please note that we will also be recording today's session and uploading it to our YouTube channel. Without further ado, I would first like to introduce our speakers, Cheyanne and Amanda. Amanda Cammalleri is a PhD student with the BC Brain Wellness Program and Dr. Silky Appel-Cresswell's lab. She graduated from McGill University in 2017 with a major in psychology and a minors in molecular biology and behavioral sciences. After completing her degree, she worked as a technical research assistant in a focused ultrasound lab at Brigham and Women's Hospital. In 2021, Amanda completed her master's degree in health kinesiology and applied physiology at Concordia University, studying the effects of an exercise intervention on sleep quality on individuals with obstructive sleep apnea and insomnia. Amanda's career as a scientist is ever evolving around her central driving force, the passion to create a positive change in the mental well-being of others through various modalities altering each individual's perception of life. Cheyanne graduated from Barry University in Miami, Florida, where she completed her bachelor's degree with honors. She majored in biology with a minor in chemistry and was an integral member of the NCAA Division II softball team. After completing her degree, she worked in a dermatology lab at the University of Miami, where she did translational research, which focused on the mechanisms of wound healing and the microbiome of chronic wounds. Cheyanne joined the BC Brain Wellness Program in July 2021 as a research assistant and is thrilled to be part of the team. I will now pass it on to Cheyanne and Amanda.
Hello, everyone. Thank you all for coming. My name is Amanda Cammalleri, and thank you for the beautiful introduction, Maria. Today, along with Cheyanne Head, we will be presenting to you Lifestyle Interventions for Brain Wellness, a 360-degree approach as part of the Research Seminar Series. So we'll start by talking about what brain health is and why it matters. Then I'll get into what are some methods we can use to improve brain health and what the current gaps in the research are. Cheyanne will then explain to you the Impact 360 study and how you can get involved. So to start, what is a healthy brain? When we first think about a healthy brain, we may think of one that can learn, read, or study. But what about a brain that's healthy enough to express itself through intricate movement and sound processing that's required to play the violin? What about a brain healthy enough to control the limbs of the body and surpass discomfort, allowing one to move their body in unique ways? What about a brain healthy enough to have the creativity and fine motor skills to allow one to create beautiful art? And finally, what about a brain healthy enough to perform the things we may take for granted, like having a conversation, walking, and even sleeping well? A healthy brain can look so different to so many people. And what about when something happens to a healthy brain, like disease or injury? At which point do we say that a brain is healthy or no longer healthy? Where do we draw the line? Is brain health the absence of disease? Or is brain health the ability to do certain things? And if so, what things? The line isn't very clear. So currently, there's no universally recognized definition of brain health. But what we can do is we can try our best to capture brain health using a scientific approach. We can look at the brain biologically and look at certain markers. So I'll briefly explain to you what some of these markers are. When it comes to measuring brain health, we can look directly at the brain by using what's called magnetic resonance imaging, or MRI, or diffusion tensor imaging, DTI. And we can look at the number of cells in the brain, or the gray matter. And in this image here, we have an MRI, and the gray matter is, ironically enough, the white parts of the brain. And these are the cell bodies. We can also look directly at the brain and look at connectivity, or the connection between cell bodies. And this is also referred to as white matter, which is the gray part of the MRI here. When it comes to studying the function of the brain, we're often talking about the connectivity of the brain. So that's how we can measure brain health directly, by looking directly at the brain. But indirectly, we can also measure brain health by looking at systems or functions that contribute to the health of the brain. For example, we can look at sleep using questionnaires, or what's called polysomnography, which is just a lab test where we observe people in their sleep and observe their brain waves to see when they fall asleep and when they wake up.
Go on.
We can also look at inflammation. Inflammation is how our immune system reacts to injury. For example, when we get a cut, our body's inflammatory response will react to it. Inflammation can be acute or short-lived, or it can be chronic, lasting weeks, months, and even years. Inflammation throughout the body can negatively impact cognitive function as well, and this can lead to symptoms like depression, loss of motivation, and loss of appetite. So inflammation throughout the body like this is often referred to as systemic inflammation, not to be confused with neuroinflammation or inflammation of the brain, which can often happen with things like concussions or diseases of the brain. So how can we measure inflammation? Well, we can measure elements of the body's immune response. When the body goes through an immune response, it releases these elements into the blood, and we can use blood tests to measure them. Finally, we can measure brain health by looking at the microbiome. So in the gut, we have billions of microbes which send signals to the brain both directly and indirectly. A new field of research is finding an increased relationship between the gut health and the brain. And we can study the microbiome by using fecal samples. So now we know how we can measure brain health, but why is this important? Why should we take care of the brain at all? Why does it matter? Well, the brain is responsible for thoughts and memory, movement, and emotions. Also, it's important to take care of the brain to prevent some neurological disorders. So we all know that it's important to take care of the brain. And by now we know how much of our perception of life and our ability to live it really depends on the functioning of the brain. But realistically, taking care of the brain can be difficult to do. Many of us don't get our recommended sleep or exercise. Many of us live lives of stress, and we may not always eat healthy. So while the brain is so crucial, it's often taken for granted, and care for it isn't always our top priority. So how can we improve our brain's health? Well, I'll go through a few simple ways right now. First, we can focus on having a healthy sleep. We can focus on getting proper oxygen and being in nature, drinking pure water, mental exercises, including meditation and mindfulness, healthy food and nutrition, sport and exercise, and getting the proper vitamins. Also, things like social interactions and avoiding things that can worsen our brain health are important. So for today, we'll choose exercise, nutrition, and mindfulness due to the large amounts of research on each of these modalities individually. I'll briefly discuss the main themes of that research with you. And as I go through research on exercise, nutrition, and mindfulness individually, I'd like you to remember that there's value in combining these therapies together. Okay, so here we have our three modalities of exercise, nutrition, and mindfulness, and all of the outcome measures for measuring brain health that I explained before. So our more direct measures of gray matter and connectivity, and the more indirect measures looking at sleep quality, inflammation, and the microbiome. I'll go through studies that look at these modalities individually with you now. We'll start with exercise. Exercise has been shown to increase the number of cells in the brain, the gray matter, and how connected these cells are to one another. When it comes to sleep, exercise has been shown to improve subjective ratings of quality of sleep. So in other words, when you ask people to rate their sleep after exercise interventions, people have reported falling asleep more quickly, sleeping longer, and waking up less throughout the night. And while more research still needs to be done, studies examining exercise interventions have found lower levels of elements released during inflammation after the intervention, indicating improvements in inflammation. Physical activity has also been shown to reduce the risk of several disorders of the gastrointestinal tract, including gastric ulcers, irritable bowel syndrome, and diverticulitis. Animal studies show significant changes in the gastrointestinal flora with physical activity. And in humans, there's been some evidence of improvements in the gut microbiome post-exercise intervention, but more research still needs to be done in this field. Moving on to nutrition. Studies looking at the Mediterranean diet, which is a diet that's very high in fruit and vegetable content and healthy fats such as omega-3 fats, have found increases in neuron growth. Different fruits and vegetables are abundant in various molecules which have been shown to improve cognition. And some research suggests that a certain micronutrient found in many fruits and vegetables can lead to neuron growth and more connectivity. However, more research still needs to be done studying this effect in people. Moving on to sleep quality, while evidence is strong for the effects of caffeine and stimulants on sleep, research is still not consistent when it comes to using a specific diet to improve sleep. So more research needs to be done in that field. Looking at inflammation, decreases in the elements that are produced during inflammation are found after nutrition interventions looking at the Mediterranean diet. And finally, looking at the microbiome, as you can imagine, what we eat does directly affect our gut and our microbiome, with diets high in fibrous fruits and vegetables contributing to a healthy gut, although this does vary between individuals. Moving on to mindfulness. Meditation interventions show that meditation can increase our connectivity and the number of cells in the brain. It's also been shown to improve subjective measures of sleep, like exercise has. So again, if you ask people to rate their sleep using a questionnaire, they'll rate it as being better after a mindfulness intervention. Mindfulness interventions have also been shown to reduce the same components of inflammation as exercise, but this literature is still mixed and still inconsistent. And when it comes to the microbiome, more research still needs to be done about any effects of mindfulness interventions on the microbiome. So overall here, I know this was a lot of information, but you can see for all these studies that looked at exercise, nutrition, and mindfulness individually on these outcome measures, you can see indications that these modalities can help brain health overall. And while I've said many times that research still needs to be done and results are inconsistent, there is some evidence out there for the beneficial effects of these interventions. However, it's important to realize I just spoke about a bunch of studies that looked at exercise, nutrition, and mindfulness individually. But it's so useful to study the three of these in combination because this is more representative of a real world intervention or real world lifestyle changes. It's very rare in real life for every aspect of our lives to remain the same except for one. It's rare for us to control everything in our lives. And as studies that have been done on only single interventions may miss out on potential cumulative effects or any interactive effects of these different modalities. So it's important to really study them in combination. So have any studies actually looked at exercise, mindfulness, and nutrition together? Well, one study in 2017 looked at exercise and meditation combined. This group looked at a low intensity exercise in the form of yoga combined with meditation on inflammation and neuron growth. They found mixed results for measures of inflammation, and they found increases in elements representative of neuron growth. Another study looked at exercise combined with diet on the gut microbiome. They looked at exercise, a healthy diet, and using a combination of the two, and found different profiles of the gut in each group. And one study examined exercise and a diet which induced weight loss and found that the diet-induced weight loss group showed improvements in elements involved in systemic inflammation. However, the exercise group alone did not show this effect. So not many studies have really been done looking at exercise, mindfulness, and nutrition specifically together. The closest thing to this has been the FINGER trial, or the Finnish Geriatric Intervention Study to Prevent Cognitive Impairment and Disability. And because this is such a huge trial and had such positive results, I'll explain it a little bit more in detail. The FINGER trial was the first randomized controlled trial showing that it's possible to prevent cognitive decline using a multi-domain lifestyle intervention in older at-risk individuals. The intervention included nutritional guidance, physical exercise, cognitive training, social activities, and the management of vascular and metabolic risk factors compared to a control group that received regular health advice alone. After only 2 years, cognition, which was assessed using a neuropsychological test, improved by 25% more in the group receiving this multi-domain intervention. Performance improved in many cognitive subdomains, including executive function, people's processing speed, and performing complex memory tasks. So overall, this study showed an effect of a multi-domain intervention on cognition. But after going through all the various ways that we can measure brain health and all the outcome measures that I went through with you at the beginning of this presentation, you can probably realize the importance of looking at multiple measures of brain health rather than just one alone. So what about studying the holistic effects? We know that the brain and body are highly interconnected. Looking at multiple measures of health impacting both the brain and body would be useful for a better understanding of mechanistics. We need to look at the whole body, the whole picture, not just one component in isolation. By taking a comprehensive view of the body and brain, this could allow for personalized interventions in the future. We know that health can change differently for different people. And by studying this in the entire body, it may allow for a personalized approach down the line. So for example, imagine one day going to your doctor's office and getting a blood test and providing a fecal sample and having your doctor come back to you with a specific intervention of exercising this amount for this many days, eating this diet, and meditating this amount to help your brain. How amazing would that be? But we need the research to get us towards that dream. So taking all the promising research behind the effects of exercise, mindfulness, and nutrition combined with the importance of studying these in the brain and body, this led us to an exciting new study. And this brings in the Impact 360 study. This is a 360-degree examination of the effects of a multimodal therapy that includes exercise, mindfulness, and nutrition. And Cheyanne will explain more about Impact 360 now.
Thank you so much, Amanda. Okay. So as Amanda mentioned, we know the benefits of exercise, mindfulness, and nutrition, but what about the combined benefit of all three? For Impact 360, we want to look at this three-armed intervention and how it impacts overall health. We will examine brain health from all angles, or 360 degrees. So what does a 360-degree approach look like? As we previously discussed, brain health is hard to quantify by just one variable. Many brain conditions are multifactorial, and there's a variety of risk factors that can contribute to these conditions. We have identified 8 key indicators of overall health that will allow us to get a more complete picture of someone's health and also tell us how our intervention changes these key indicators. So what are these key indicators of health? Well, let's start with cognition. We know that cognitive function can change a lot throughout our life, and it's something that we'd all like to preserve as we age. Blood markers. As you can probably imagine, your blood can tell us a lot about what's going on with the rest of your body. We can look at markers in your blood to see if there's inflammation throughout your body and look at other indicators that can tell us more about what's going on with your health, diet, and risk for other conditions. Brain imaging. We want to scan your brain to look at the structure and how different parts of your brain function together. This may be what people traditionally think of when they think of brain health, but as we now know, there's so much more to it. Sleep. It's no secret that sleep length and quality is vital to a healthy lifestyle, but consistent poor sleep can put you at risk for certain conditions and may actually be a warning sign for other health problems. Looking at the quality and length of sleep that one gets can tell us a lot. Emotional well-being. We're going to look at things like social relationships, your sense of belonging and quality of life, and your psychological health, such as levels of anxiety and depression. These are known to have a surprising influence on other aspects of your physical health and the aging process. Heart health. So this is another one that's less surprising. We all know that things like high cholesterol levels, high blood pressure, and high blood sugar can put you at risk for heart disease and diabetes. But these may also put you at an increased risk for other diseases, including some neurological conditions. Gut health. Amanda spoke briefly about the connection between your gut and your brain. We want to examine what types of bacteria are present in your gut, given that certain species of bacteria have been associated with certain neurological conditions and other diseases. And lastly, fitness levels. We know that physical activity throughout your life is important for your overall health, and that a more sedentary lifestyle puts individuals at risk for health conditions. We're going to track the amount of physical activity that you get in a day and measure how fit you are. This includes how your lungs, heart, and muscles work together during exercise and how efficiently your body uses oxygen. We will also look at things called functional measures, which are things like balance that can impact your day-to-day activities. So as we mentioned, there's not just one measure of brain health. And so we'll look at a combination of these measures to get a comprehensive idea of someone's overall health and monitor how it changes throughout the study. So what does our study look like? So this is a simplified overview of our study. First, we'll look at your eligibility to see if you're a good candidate for our study. Then we'll do a baseline assessment. So this will involve lots of tests, including the 8 key indicators of health that I discussed on the last slide. We're going to do these tests 3 times throughout the study, at the beginning of the study, after the delayed start period, and after the intervention. After the first assessment, participants will go into a delayed start phase for 6 months before the intervention, which will also last for 6 months. So what's a delayed start? A delayed start is a period in time where we will monitor your health and activities before having you start the intervention. It's really important during this time that participants don't change anything. The reason for this is because we want to see what you look like when you're just living your normal life, and then we want to see how your health changes when we give you this special intervention of exercise, mindfulness, and nutrition. So basically, once you enroll in the study, we'll do a bunch of tests, send you home to live your life, and then have you come back to do those same tests again 6 months later before you start the intervention. So why are we doing this? Assuming that what we're doing is beneficial, we don't want to exclude anyone. This allows us to give the intervention to everyone without having a whole different control group that won't experience the benefits of the intervention. Also, as Amanda mentioned before, these interventions and cumulative effects can impact each individual differently. By collecting data from each participant before and after the delayed start period and the intervention, we're able to see how each phase of our study impacts each individual. Now, let's take a deeper dive into the details of the intervention. As we mentioned, our intervention has 3 modalities. Starting with mindfulness, we're going to give you mindfulness-based stress reduction training with a certified instructor. This training has been shown to have significant effects on individuals' physical and emotional health. You'll have the opportunity to practice these skills in group-guided meditation sessions and have discussions with a mindfulness coach. We'll also provide you with some recorded meditations in case you want to practice extra on your own. The exercise portion will consist of 3 classes per week. You'll be able to modify the exercises taught in these classes to suit your individual fitness level. These classes will progress over the 6 months of the intervention so you can continue to challenge yourself and improve your physical fitness. For the nutrition portion, we will provide you with nutrition coaching and goal setting with a certified nutritionist or dietitian. We're also going to give you cooking classes from a chef and a repertoire of recipes so that you can feel prepared to make meals and choices that are good for your mind and body. All aspects of the intervention will be delivered virtually through Zoom. However, participants will need to come into UBC for the 3 assessments. We will provide a Fitbit for participants to wear throughout the study, and we'll use this wearable technology to collect data. So who can participate in this study? Most of this will be determined during the eligibility screening. The screening can be done remotely before coming into UBC for the first study visit. To start, we're looking for individuals aged 50 to 80 without a neurological condition. We want to make sure that individuals are safe to participate in exercise, so participants with unstable cardiovascular or respiratory disease may be excluded. Since we are imaging your brain, you must be able to have an MRI scan. Some things that may exclude you from being able to have an MRI are extreme claustrophobia, having any metal in your body, such as orthopedic plates or screws, metal fragments, or a pacemaker. So, why should you get excited about this study? Well, most studies usually look at one variable. Then, given the conclusion of that study, they do another study to look at another variable. In this study, we're taking a much more comprehensive approach and looking at many different variables at once. As Amanda mentioned, to our knowledge, this is going to be the first study combining these 3 interventions and evaluating so many different measures of health all at once. We also believe that so many populations will benefit from this intervention. So while we're starting this study in a healthy aging cohort, we're also planning to replicate it in other populations such as Parkinson's disease, Alzheimer's, and multiple sclerosis, once we're able to obtain further funding. This study also validates what we're doing in the BC Brain Wellness Program. We hope to leverage the results of this study to continue to offer our lifestyle and wellness classes as part of our program for free and to continue to expand throughout the province. While we're still in the early stages of getting approval for this study, we're looking for interest and potential participants. Even if you have a condition and are interested in research, you can visit our website. Along the top of the homepage, there's a button called Research Participation. This will take you to a form to fill out, and we'll contact you if we need any further information. Or you can contact me or Amanda by phone or email. The phone number here on the screen is the BC Brain Wellness phone number, but it will connect you to me. Thank you so much for your time, and we're looking forward to the impact that we can make together on health and wellness.
Thank you so much, Cheyanne and Amanda, for your wonderful presentation on combined interventions and also the amazing upcoming study, Impact 360. And we will now proceed to the Q&A session. So I do see there are some questions popping up in the chat. If anyone has any more questions, please feel free to send them in the chat box. So we do have a question here. Is The study sounds great, except I live in Ontario. Is there anything that can be done about this?
Unfortunately for now, yeah, we still are having to have participants come in for the assessments in person because we are doing MRI scans, which we can't really do remotely, and some of the other testing that we are doing. So right now, participants will need to come into UBC to have those assessments done.
Great. And another question here that came through internally is, what sort of blood markers are used to indicate health? I believe this was something that came up a little bit earlier on in the presentation.
Yes, with the blood markers, we're really looking at different measures of inflammation. So we're looking at what are called pro-inflammatory and anti-inflammatory cytokines, which are released throughout the body when there is an inflammatory response. So for the exercise cytokines, I don't know if you're already aware of them, but we're looking at IL-6, IL-10, TNF-alpha, and CRP.
Great, thank you, Amanda, for answering that question. A lot of questions here are popping up about the location of the study. Would either of you like to touch on that?
The location of the assessments, or?
Yes, the assessments here. There's lots of questions asking about if the study can be done in person at UBCO. We can also, if anyone has questions about specific inclusion or exclusion criteria, you can also feel free to contact Cheyanne. We will be pasting the contact information into the chat box if you would like to get in touch.
Yeah, for those of you that are asking about UBCO, I would still either fill out the research participation form or send me an email. There might be something we can do down the road. We don't have that infrastructure or that relationship in place right now, but it's definitely something that could be possible if there's a lot of interest in Kelowna or the Okanagan. So, and additionally, if you think you may be kind of in that exclusion criteria, or you might not qualify for the study, but you're still interested, still send us your information. There might be another study that you might be fit for, or we might be able to make some adjustments and kind of determine your eligibility at that point.
Thank you, Cheyanne, for answering that question. So here we also did send the contact information of Cheyanne and Amanda into the chat box, as well as a link to the research study inquiry form where you can submit your interest into the research study. And another question here is, will it be done virtually or in person? I assume this refers to the classes.
Right, so the classes will all be virtual. However, we will need to do in-person data collection. So that would be at baseline after 6 months, and then after another 6 months. But the classes will all be online.
Great, thank you for clearing that up, Amanda. Another question that we have here is, I am already involved with the Exercise BC Wellness Program. Could I continue, or could I participate in this study? Or sorry, no, we'll rephrase that. So I'm already involved with the Exercise BC Wellness Program. Could I continue? So yeah, either of you could possibly touch on this.
Yeah, definitely. So I would say, again, if you're interested at all, send us your information and that can be something we discuss. But yeah, for sure. Like we don't want you to stop exercising. If you have a great exercise routine, please continue doing that. And yeah, hopefully we can still get you in the study and still have you experience the benefits of the nutrition and the mindfulness as well. So
that sounds great.
Adding on to that, I think if anyone has any questions about inclusion, exclusion criteria, when in doubt, just fill the registration form out. We will be looking at inclusion and exclusion criteria, but it's worth trying. So yeah, just fill out the registration form if you're interested at all. And if not for this study, it could always be for another one as well.
Great, thanks, Amanda. Another question here is there any plan to have research sites outside BC in partnership with, say, University of Toronto or United Health Network in Ontario?
Again, as I mentioned before, currently we only have the set up at UBC, but it's something we could look into, or again, there might be other studies that, are kind of similar that you might be able to get involved in that are have locations elsewhere. So right now it's only UBC, but definitely something that we can look into, maybe finding some collaborations and working out.
Great. Another question that just came up is, how rigid is the diet component of the study, or is the diet component mostly just general guidelines?
So the diet component will be the Mediterranean diet, which is a diet that's high in fruit and vegetable content and limits the amount of fats to healthier fats. So it's really going to be guidelines and also and recipes that follow those guidelines. And then we'll be tracking what you eat just to use it for our data collection. But there are many different types of fruits and vegetables that you can do, and yeah, many different ways to modify this diet to your lifestyle. It's really based on whole foods.
Great. Thank you for clarifying that part, Amanda. Another question here is, the pandemic affects many people's normal routine, such as exercise, socialization, activities, etc. So how does that affect your assessment of a participant's lifestyle prior to the 360 intervention measures?
So I guess this brings it back to kind of the reason we're doing the delayed start. So by monitoring people through that delayed start period, we're able to see what their normal life kind of looks like, and then know how that changes with the intervention. So yeah, we don't have any data obviously pre-pandemic, but we can look at the current state and kind of what you're doing now, and then how that changes throughout our intervention.
And adding on to that, let's say that the COVID situation does change over the span of the study. We are collecting sleep data, we're collecting exercise data, we're collecting nutrition data. So if your schedule changes, that will all be represented in the data anyways.
Great. There are a few questions popping up about the timeline of the study and when the start date is.
So right now we're still waiting for just ethics approval, and we're trying to get it underway as soon as possible. So we're hoping that participants can kind of start in the spring. So yeah, right now, as I said, we're trying to collect interest and potential participants. So yeah, please, if you're interested, contact us or fill out that form, and we will let you know as soon as we start enrolling participants.
That sounds great. Another question here is, can you use previous MRI scans to see any changes?
We will be using our new baseline MRI scans just to keep it consistent across participants. You can, if you have your own MRI scans from the past, look at it, or you can bring both MRI scans to your family doctor after filling out certain forms. But for our study and for the sake of our study, we will be keeping that consistent with a baseline scan, a scan after the 6 months, and then at the end of the study.
And following up with these sort of data collection questions, another question that came up is, how do you collect the sleep data?
Within the Fitbit is what's called an accelerometer, and that measures movement. So it measures movement during sleep, and through that we can measure when you're in bed and still, and when you're in a deeper stage of sleep and more still. And then we can use that to look at different variables of sleep quality.
Great, thank you, Amanda. Another question is about the eligibility criteria. So it is, I turn 80 in October. Does that disqualify me?
Good question. Probably not. I think if you enroll in the study and you're still under 80, then I think we'd probably still accept you into the study.
That makes sense. Thank you, Amanda. Thank you, Cheyanne. Another question here is, Sorry, I'm just looking through so many questions. So if any more questions pop up, please feel free to send them in the chat. A question that just came up is, the application requires you to enter a disease diagnosis before you can submit the form. Do you have to have a diagnosis to register?
No, so our study is actually first looking at healthy agers. So yeah, I didn't actually I didn't know that was on the form and required. You can, if there's a place to comment, you can just maybe select a disease and then just write a comment if there's any blank space that I'm a healthy ager, I have no disease, or click other. Yeah, as Matt said, you can click other, and then we'll know that you're either a healthy ager or don't fit into those categories.
Okay, perfect. I don't see any more questions, but if there are any more questions, please feel free to send them in the chat. We do have a little bit more time to answer any questions or thoughts that might come up. Another question is, what is the time commitment for the study? So I suppose this refers to the frequency of the classes.
We will be having exercise classes 3 times a week, followed by 15-minute meditations after the exercise courses. There will also be a mindfulness-based stress reduction course once a week that's 1 hour long, and a nutrition course bi-weekly that's 1 hour long.
Wonderful, that's such a great variety of classes. Another question that came up is, does the MRI use intravenous contrast?
No, so I think we are just doing an MRI without the intravenous markers.
Okay, great, thank you. I may have missed questions. If I missed any questions, please feel free to send them again and we will get around to them. A comment here is, what amazing research. Is there a website I can share with my friends or family who missed this session? So as this session is being recorded and it will be uploaded to the BC Brain Wellness YouTube channel. So once we get that up, you will be able to share it. We also do have here, Matt has posted the link in the chat to our event page where we upload the recordings of these sessions that your friends or family or anyone who missed the session will be able to refer to. How many people do you need for this study is a question that just came through.
We are starting the study as a pilot study. So our aim is to start with 100 participants and then
50.
Oh, sorry, 50 participants and then hopefully expand.
Great, thank you for answering this question. We still have a bit more time, so if there are any more questions, please do feel free to send them in the chat. Or any thoughts that you would like to share, or anything like that. I did also want to share that we do have another research seminar series happening next month. So I will paste the link in the chat in case you would like to check it out and register. It's happening on Wednesday, March 16th at noon, same time as now. And the topic will be non-invasive neurostimulation therapy. So it's another great and exciting session. Otherwise, I'll just give it a few more seconds to see if there are any more questions. Otherwise, I would like to give a huge thank you to Amanda and Cheyanne for presenting at today's session. Your insight on nutrition, exercise, and mindfulness was really insightful, and the Impact 360 study sounds super exciting, and I know that we're all really looking forward to it.
Thank you, Maria.
Thank you all for coming.
Yeah, and thank you everyone for joining us today. And I hope you all enjoy the rest of your day.